Chronic obstructive pulmonary disease, COPD, is a progressive respiratory disorder characterized by airflow limitation that is not fully reversible. It encompasses a group of diseases, including emphysema, chronic bronchitis, each with distinct pathophysiological mechanisms and clinical implications. This video aims to elucidate the fundamental aspects of these obstructive lung diseases and delve into the core principles of COPD management, including smoking cessation, oxygen assessment, pulmonary rehabilitation, and medication options. Obstructive diseases of the lungs, pathophysiology and clinical implications. Emphysema. Emphysema is marked by the destruction of alveolar walls, leading to decreased gas exchange surface area. This results in reduced oxygen transfer to the bloodstream, causing dyspnea and impaired exercise tolerance. Morphologically, emphysema is characterized by enlarged air spaces and loss of lung elasticity, contributing to air trapping and hyperinflation. Clinically, patients often present with progressive shortness of breath and a chronic cough. Chronic bronchitis. Chronic bronchitis involves chronic inflammation of the bronchial tubes, leading to excessive mucus production and persistent cough. Inflammation narrows the airways, causing airflow obstruction. Morphologically, chronic bronchitis is distinguished by hypertrophy of mucus glands and increased goblet cell hyperplasia. Clinical symptoms include productive cough lasting at least 3 months for 2 consecutive years. Asthma is a chronic inflammatory disorder characterized by bronchoconstriction and increased mucus production. Inflammation leads to airway hyperresponsiveness and reversible airflow obstruction. Morphologically, asthma presents with airway inflammation, mucus plugging, and smooth muscle hypertrophy. Clinical manifestations include wheezing, coughing, and shortness of breath, often triggered by allergens or irritants. Bronchiectasis. Bronchiectasis involves the permanent dilation of bronchi due to chronic inflammation and recurrent infections. Bronchiectasis is an obstructive disease but is not considered COPD. Morphologically, it is characterized by bronchial wall thickening and excessive mucus production, leading to impaired airway clearance. Clinically, patients experience chronic cough, recurrent infections, and hemoptysis. Core tenets of COPD. Management. Smoking cessation. Smoking cessation is the most effective intervention in COPD management. Continued smoking exacerbates inflammation and lung damage. Counseling, nicotine replacement therapy, and pharmacotherapy are essential components of smoking cessation programs. Oxygen assessment. Oxygen therapy is crucial for COPD patients with hypoxemia. Arterial blood gas analysis helps determine oxygen levels. Long-term oxygen therapy, LTOT, improves survival and quality of life in hypoxemic COPD patients. Pulmonary rehabilitation. Pulmonary rehabilitation is a comprehensive program involving exercise training, education, and behavioral interventions. It enhances exercise capacity, reduces symptoms, and improves quality of life. Patients learn breathing techniques, energy conservation strategies, and emotional support. Medication options. 1. Bronchodilators, short-acting and long-acting bronchodilators, beta agonists and anticholinergics, alleviate bronchoconstriction, improving airflow. 2. Inhaled corticosteroids, ICS reduce airway inflammation and prevent exacerbations, often used in combination with bronchodilators. 3. Phosphodiesterase 4 inhibitors. These medications reduce inflammation and relax airway smooth muscles, especially in patients with chronic bronchitis. 4. Antibiotics, used to treat exacerbations, targeting bacterial infections. 5. Mucolytics, aid in clearing mucus, particularly in chronic bronchitis and bronchiectasis. Conclusion. COPD, comprising emphysema and chronic bronchitis, asthma, imposes significant morbidity and mortality worldwide. Understanding the distinctive pathophysiology and clinical implications of these obstructive lung diseases is paramount for effective management. A holistic approach, encompassing smoking cessation, oxygen therapy, pulmonary rehabilitation, and appropriate medication, is essential in improving the quality of life and outcomes for individuals living with COPD. Early intervention and comprehensive care can mitigate symptoms, enhance exercise tolerance, and ultimately improve the overall well-being of COPD patients. Thank you for watching, And be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have.